Hello, everyone. So I'll begin by wishing you all a Happy New Year. This is our first video blog for 2017. So we have a couple of topics that we felt would be important to cover because they're the subject of energy at the college, mainly by our Department of Research and the section of researchers. And those topics are the concept of research-ready practice and quality improvement in practice. So I thought that for this, I'd invite our Director of Research, Dr. José Pereira, to tell us a little bit about this, and we'll do this in as much of a conversation style as we can. So José, thanks for doing this. So you've been with us at the college now for 10 months or so?
That's correct, yeah.
So when we think about research and family practice, we're obviously thinking about something that goes well beyond the traditional clinical trial. So you want to tell us a little bit about the concept of research and family practice and how we think about that?
Certainly, I think that it's important that we note that when we ask family physicians and other primary healthcare providers, do you participate in research? Are you involved in research? The response is often no. And so I think people look at it in too narrow way. And they think of it only in terms of clinical trials, of randomized, double-blinded controlled trials, and sometimes retrospective studies. But research, we know, involves many other activities. It's a whole spectrum. So it ranges from the simple act of when you're seeing a patient, and that encounter generates a question about what is the best treatment, or what are the diagnostic possibilities over here. And we go and look it up, and we go read it up wherever our sources are. That is a research activity because you're looking for some evidence to support the decision-making process. When we're designing health services, our clinics, our practices, we ask, what's the best way of doing it? So that's a question, and that's generating research. And so the research spectrum involves everything from applying practice-based evidence to reading up articles in our journals, to looking up evidence for a treatment plan, to preparing clinical practice guidelines, to adopting and adapting clinical practice guidelines. And quality improvement is also part of that. And then at the other end of the spectrum, you've got the larger studies, the clinical trials. So I think we need to think of it in that way and not this narrow way of thinking of research only as a clinical trial.
Very good. So now moving from that to talking about what it is to be research ready in family practice. So this is a concept which I understand emerged in the United Kingdom. Can you tell us a little bit about that?
Correct. So the concept of research-ready practices started in the United Kingdom a few years ago. And basically what it entails is helping practices, family physicians and practices, becoming acquainted with research and research methods so they can become part of research programs. It involves an education program to bring them up to speed, and then once they're ready to participate in studies, in research, then they apply for a designation by the Royal College of GPs in the United Kingdom. And if they meet the criteria, they then receive that designation. Now, what does that mean? Well, it means then that researchers, whether it be within departments of family medicine or other researchers in the healthcare system, pharmaceutica, companies are looking at new medications, etc., can then approach these practices so that these practices then, because they know how to recruit patients, they know how to manage the data, they're now ready to participate in those studies. So in the UK, it's become very popular. There are hundreds of practices and clinics that have that designation, and others are coming on board. And in the UK, they have focused a lot on clinical trials. They're now beginning to look at it more in terms of a spectrum of research readiness, not just clinical trials, but being ready as well, for example, to participate in sharing data from one's electronic medical records. Collecting data alongside in collaboration with other clinics in the vicinity about one or other condition.
Okay. So I'm aware, though, that in the United Kingdom, the government is actually helping with the financing of those activities. So obviously, we're nowhere near that in Canada. So how do you see us transposing that concept and applying it and implementing it in a Canadian context?
So I think the approach is obviously additional resources will help us scale up things much quicker and will able to bring us up to speed to a level much quicker. But I think we should plan as well for the absence of those type of resources. And if those resources are not present, then the question is, how can we still advance this concept of practices being at the front line of doing research and involved in one of those research activities I described earlier without too many additional resources? And so in Canada, at the college, we're looking at the concept of levels of research readiness. And at its most basic level would be, for example, participating in a network of practices that collect data. And it could be as easy as going into electronic medical record, pulling out, for example, the number of patients that we have in our practice with chronic disease and what are the profiles of those chronic diseases? How are we managing diabetes, hypertension, etc.? And if you start then collecting and working together as a network, you start collecting very important data, which then makes it available to researchers who are collaborating with you to analyze that. And that in turn can then help the practice, because then the practice can look at it and say, well, how do we fit into our peers? Are we over-treating? Are we under-treating? Are we under-recognizing? Are we over-diagnosing? So I think in our context, we're going to look at ways that we can do the research readiness at the most basic level. So being part of a network, being part of a concept such as CFPC. So CFPC is the Canadian Primary Care Surveillance Sentinel Network, which is a phenomenal resource that we have in this country that really needs to be scaled up. And so these are hundreds of practices that share the data into one collection point at Queen's University around 8 chronic conditions, hypertension, osteoarthritis, etc. And that then gives enormous amount of rich data to analyze patterns of diseases across different regions. What are the type of patients being seen in family practices? What are the treatments they're receiving?
Okay. So, and I guess another parallel to that would be the practice-based research networks, and we have some of those in different parts of the country, but more of them, I guess, in Edmonton and Toronto, and possibly expanding that kind of a network?
Very much so. So at the forefront, I would argue, of this research readiness are practices that are collaborating within a network. And so the concept of practice-based research networks, or PBRNs, is exactly that. It's a group of practices that collaborate together to do research together. And again, it could be as simple as I've got very important and rich data in my medical practices, in my medical records. Obviously, these get de-identified, so it's anonymous, and the data then becomes aggregated. But that we can then analyze to see patterns of disease, treatments, etc. Now, PBRNs, we have about 15 to 16 across the country. So in other words, there are 15 to 16 networks, some small, some much larger. There's a very large one in Toronto, for example, called Utopian. Many practices that come together to collaborate in research. There's also a relatively large one out of northern Alberta, but stretching out across the prairie provinces and into BC as well, where they're doing some amazing work. And in their case, they're actually doing clinical trials and clinical studies using the resources they have already. So our goal is to enlarge these PBRNs, get more practices joining up these PBRNs, and where there are gaps, create new PBRNs. And through our Research Ready Practices program, we want to develop those resources, toolkits that can help a family physician, the primary care team, the practice, become acquainted with what is a PBRN, how do we join a PBRN, how do we start a new PBRN, where can we get some help, where can we get some resources, how do we do this, how can we join CFPC, how can we submit our data, what can we get in return for it. So, exciting times.
Exciting times.
Yes.
So shifting gears just a little bit to look at quality improvement in practice. So we're dedicating some energy to this. How does that link to the research readiness that you just talked about?
So we all know that quality improvement is at the forefront now of change and innovation in the healthcare system. Getting better quality of care, more efficient care, better services, etc. Quality improvement is not always research, and research is not always quality improvement, but they do overlap quite often. And sometimes we use research methods within a quality improvement project, and often quality improvement projects, there's fantastic data and findings that come out of that contribute to the evidence base that we have. But they do have something that's extremely important in common, and that is a culture of curiosity. Mm-hmm. So in other words, it's a culture where a family physician, where a nurse, a social worker working within that team are asking individually and as a team, why are we doing what we're doing? Can we do it better? Mm-hmm. Where is the evidence for doing this? How can we better manage this condition? And so that's what we want to nurture. We want to nurture this culture of curiosity and support it in the front lines, so that quality improvement and research becomes relevant at the front lines of care, not just in ivory towers of research. And so in order to promote and advance the quality improvement, we're looking at developing a similar program as Research Ready, but this one will be called QI Ready Practices. And at its essence is support for family physicians and their colleagues from different professions, to how to do quality improvement, how to get it started, how to maintain it. And what we'll be doing is collaborating with colleagues across the country to build up these resources and this initiative.
Okay. So obviously we have a moderate bit of work to do in terms of preparing family physicians for this type of engagement. What are the immediate next steps in relation to this?
So the good news is that there are already pockets of excellence in this occurring across Canada. So, for example, there are some departments of family medicine that are doing fantastic work at getting their residents and their faculty prepared to undertake quality improvement. We have initiatives at provincial levels. In Ontario, for example, Health Quality Ontario have got a whole quality improvement program for primary care. In Saskatchewan, they're pushing out one of the methods called lean methods for quality improvement. We have already programs, individuals and programs looking at research ready. I mentioned Utopian out of Toronto earlier. They're already beginning to pilot this concept of research readiness in the Toronto area. So we already have some fantastic stepping stones that we can leverage. And so in the next few months, we're going to be doing an environmental scan, collaborating with partners such as the Canadian Foundation for Healthcare Improvement, colleagues from Toronto, from Edmonton, where we're going to scan and look across the country to see what is already existing in terms of quality improvement and tools to help with that, education programs, what already exists in terms of research and research preparedness, so that by the middle of the year, we can then design a program that we can scale that all up and make it pan-Canadian and provide the supports, link it up with continuing professional development, main pro credits, for example.
Excellent. So thank you, José, for this overview. So we'd encourage you to read about this, to get yourself up to speed in the measure that you can, until we can deploy this initiative more fully, as José has described. There is an excellent article in the Canadian Family Physician Journal that describes the ecology of research, as José described at the beginning of this interview, and would encourage you to review this, and we'll provide the link as part of this video blog. And of course, as per usual, if you're interested in providing some comments, don't hesitate to connect with me by Twitter or via email, and either I or José will be pleased to respond to you. And until our next video blog, have a good week and take good care.